Welcome to Tocilizumab Chronicles, Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and today we are joined by Prachi Virat, our microbiology seamstress with a passion for microbiome and bioinformatics. Welcome to the show, Prachi. Let's get into the heart of tocilizumab in today's episode. Tocilizumab in practice, dosing and administration strategies.
Thrilled to return, Dr. Shikha. I had such a great time last time. I can't wait to dive back in.
Let's dive into the dosing and administration of tocilizumab. What are the standard dosing protocols for tocilizumab?
Absolutely. So, the dosing of tocilizumab depends on the indication and routine of administration. In severe COVID 19 cases, the standard recommendation dose is 8 mg per kilogram of body weight, given as a single intravenous infusion over 60 minutes. The maximum dose typically caps at 800 mg. In other conditions like rheumatoid arthritis, it can be given intravenously or subcutaneously on scheduled basis, often every 4 weeks. But for COVID-19, it's usually a one-time dose with a possible second dose consideration if there is no clinical improvement within 24 hours, though that depends on guidelines followed.
That's helpful to know. How do dosing protocols change for specific patient populations, such as pediatric patients or elderly patients?
Great point. Dosing adjustments are important for special population. For pediatric patient, dosing is weight-based, similar to adults, but specific pediatric guidelines are used for conditions like juvenile idiopathic arthritis. In COVID-19, however, its use in children is more restricted and typically limited to severe or critical cases in consultation with specialists. As for adult patients, no routine dose adjustment are recommended just based on age alone. But clinicians do need to closely monitor for adverse effects like increased risk infection, since older adults often have other infections and may be more immunosuppressed.
Are there specific dosing considerations for patients with hepatic or renal impairment?
Yes, definitely. But interestingly, no formal dose adjustment are currently recommended for mild to moderate hepatic or renal impairment. However, in patients with severe elevated liver enzymes or hepatic dysfunction, tocilizumab is generally avoided because it can itself raise liver enzyme and increase the risk of hepatotoxicity. Regular liver function monitoring is essential when using tocilizumab. As for renal impairment, since it's metabolized by protein catabolism rather than renal excretion, dosing typically remains unchanged.
Well, how do clinicians determine the optimal dosing schedule for individual patients?
Great question. For COVID 19, the dosing schedule is pretty standardized. A single dose based on body weight, with a possible second dose if necessary. But in other chronic conditions, dosing frequency is based on clinical response, severity of disease, and biomarkers level like CRP. For example, in rheumatoid arthritis treatment might start at a standard dosing every 4 weeks, then be adjusted based on how well the patient's inflammation is controlled and any side effects encountered. Close monitoring of inflammatory markers and liver enzymes guide these adjustments.
Finally, what's important for clinicians to keep in mind when administering tocilizumab?
Certainly, there are a few key points. First, timing matters. In COVID-19, tocilizumab should be administered during hyperinflammatory phase, ideally before patients progress to invasive ventilation. Second, patient selection is critical. It's most effective in patients with elevated inflammatory markers like CRP, ferritin, and IL-6. Third, monitor for adverse effect, including liver enzymes elevations, risk of secondary infections, and gastrointestinal complications like bowel perforation in certain high-risk groups. Lastly, when using it combination with corticosteroid, clinicians need to be vigilant about additive immunosuppressive effects.
Your insights were incredibly valuable, Prachi. It's been really a pleasure having you on the show.
Really grateful for the invite, Dr. Shikha. Thank you.
To our listeners, huge thanks for listening. Be sure to follow the show and share this episode with someone who loves staying curious. Until next time, stay curious.